Hello, I am Dr. Tanveer Ahmad, Associate Professor Animal Nutrition at Arid Agriculture University, Rawalpindi. In this video, I will discuss dairy cow nutrition. The feeding management and nutrition of dairy cattle will be discussed in this video. The dairy cattle production cycle is divided into different phases because the nutrient requirements they are different in each phase due to difference in milk yield, dry matter intake, and then the restoration of the body, and then coming the dry period. If you look at this slide, the production cycle is divided into four phases. The first one is the peak milk phase. The second one is where dry matter intake is at its peak, and during the third phase known as a restoration phase, and the fourth one is a dry phase or dry period. Here you can see the production cycle is divided into 6 phases rather than 4 phases, where the phase 1 and phase 2 is the division of the dry period, while the phase 3 is from calving until 2 to 3 weeks after calving, and phase 4 that is early lactation and peak milk yield phase, and phase 5 is the peak dry matter intake, and phase 6 is tail and lactating cow phase. So just look at the graph. The topmost curve is indicating the milk yield of the animal, whereas the second and third they are indicating about the fat and protein contents changes during the lactation cycle, and third from the top is indicating the dry matter intake, and the lowermost is the indicative of body condition score. So if you look at the topmost curve, the milk production sharply increases after parturition and reaches peak lactation between 40 to 70 days, and then steadily declines until the cow is dried off. Feed intake, however, decreases sharply before calving and cannot catch up with the milk production until 120 to 140 days after parturition, and the cow is in the negative energy balance. From a nutrition standpoint of view, it is important because the diet during this period should be formulated to minimize the impact of negative energy balance on milk production. We will discuss these phases one by one, and their nutrient needs during these phases. So now comes to the 6 stages of lactation. Stage 1 begins at drying off time to 21 days before calving. It means 60 to 21 days before calving, or in some cases 16 to 14 days before calving. This period is also known as traditional dry cow period. During this stage or the dry period actually begins the next lactation. So during this stage, the cow's mammary gland they involuates. Mammary glands usually dries up and appears as a collapsed structure. At this time, the calf is increasing in size and developing, and the body weight gain can be occurring. Then comes a stage 2. Stage 2 is referred as close-up dry cow period. So it is 21 days prior to calving, or in some cases it is 14 days prior to calving or lactation. So this is also known as close-up or transition dry cow period. It is critical in this phase to prepare for lactation by adjusting the rumen environment and also to prevent metabolic disorder. During this stage, it is considered that increasing the level of grain in the animal diet, it shifts rumen microbes to the type that can ferment high energy diets and stimulate rumen papilla to elongate and increase papilla surface area. Then comes stage 3. Stage 3 is the fresh cow phase. It is from calving until 2 to 3 weeks after calving. The key management factor is the ability to monitor and observe these cows to ensure they are healthy when they are moved to the high production group or are challenged with the high nutrient rich diet. The stage 2 and 3 collectively also known as the transition period. Stage 4. 14 to 17 days after calving. This stage is also known as early lactation and peak milk yield. During this stage, cows are in negative energy balance. Cows are achieving peak milk production and there is a loss in their body weight. And at this time, the dry matter intake is lagging behind the milk production. That's why there is a requirement of additional source of energy at this time. Phase 5, 70 days after calving to 200 days or until dry. It is also known as peak dry matter intake and declining milk production phase. It is also known as mid and late lactation phase from 140 to 305 days. During this phase, cows will have achieved peak milk production. The peak dry matter intake has also occurred with no weight losses occurring. So if milk production or the components they are declining too quickly, nutrient needs are not being met. The key to success in this phase is to optimize dry matter intake. Stage 6, some cows herds will not reach this phase. So phase is known as tail and lactating cow phase, and it is from 200 to 250 days. During this phase, cows are pregnant, they are gaining weight and milk production is declining. Dairy cow nutrition is based on the nutrient requirement, and feeding as per nutrient requirement depends on the stage of lactation and the stage of gestation. There are 4 key factors that changes as the cow move through the 6 phases of the gestation and lactation cycle. These 4 factors are: number 1, animal milk production; number 2, milk fat and protein contents; 3 is the dry matter intake of the animal, and the last one is body weight loss and gain. The first factor is milk production. So look at the diagram. The first factor is the milk production. Look at the graph. The topmost curve is the milk production curve. Milk production drives nutrients, and nutrient they move towards the mammary gland for the synthesis of the milk. Peak milk sets the lactation curve for cows. Peak milk to occur 40 to 60 days after calving. It is considered as first calf heifers. The first lactation cows should reach peak milk levels 75% or greater than that of the peak milk of older cows in the herd. For example, if first lactation cows average 27 kg of peak milk, while older cows average 36 kg of peak milk, the ratio is 75%. If the ratio is less than 75%, the first lactation cows are not peaking relatively high enough compared to older cows. If first lactation cows peak over 75% of older cows, heifers are peaking higher relatively to older cow peak milk yield. So this is a good news. So it might be related to good genetics of the heifers, their health, their managemental practices, all that matter towards. But in the other case, it might be a bad news, because if older cows are not performing well or they are not reaching their peak milk yield. Second and third curve, they are the milk fat and protein curves. So milk fat and protein levels vary with the breed. So if milk fat test is below milk protein test by 0.2 points, for example 2.7% milk fat and 3% milk protein, showing that ruminal acidosis could be occurring. If milk protein test is below breed average, or if it shifts during various phases, then you have to consider the following reasons for low milk production. It might be due to lack of rumen fermentable energy or presence of less amount of fermentable carbohydrates, because low levels of fermentable carbohydrate lowers microbial protein synthesis and amino acid for milk protein synthesis. The second is the diet have a high amount of fat. So when dietary fat or oil contents they are high or they are used as energy source, that fat or oil is not a source of human fermentable energy. So ultimately it will reduces the energy available for microbial protein synthesis. The third is lack of protein amino acid, or there is an imbalance of amino acid and poor dry matter intake. Low levels of dry matter intake usually reduces the supply of nutrients available for the ruminal microorganisms and to the cow. Shortage of protein, essential amino acids, or imbalance of amino acid do have the same impact. The third factor is dry matter intake. If you look at the curve in the figure, so this is second from bottom to the top. Increasing cow dry matter intake after calving can avoid metabolic disorder. It also minimizes the weight loss and it improves the reproductive performance of the animal. Care must be taken to have a very close look on the dry matter intake of the animal, and all efforts should be made to improve postpartum dry matter intake of the animal. The last factor is the body condition scoring or body weight loss and gain curve. This is the first from the bottom in the graph. This body condition scoring helps to determine the energy status of the animal. If we are closely monitoring the body weight changes in the cow, it will provide information on the energy status of the cow. High producing cows will lose weight to provide the high energy levels needed in the early lactation. That's why animals are in negative energy balance in the early lactation. A body condition scoring can be used as a tool to determine the weight changes in the animal. Body condition score is a subjective measure of subcutaneous fat thickness and a reflection of energy reserves of the animal. It can be used as a good tool in the field to monitor the weight changes. So in different countries there are different type of scales. Usually it is on a scale of 1 to 5. It is being used in USA or other western countries, whereas New Zealand or Australia they are using a body condition scoring scale from 1 to 10. So if we consider this, the one body condition score is equal to 54.5 kg body weight of the animal. It is recommended that cows should not lose more than 1 to 1.5 body condition score points. It means they should not lose more than 54.6 to 90.9 kg of their body weight. So these photographs are from Elanco. This shows the spectrum of condition scores of cow and how cows can lose weight and also gain weight. Cows with proper body conditions, they are less likely to have problems at calving. The goal is for cows not to lose more than one condition score after calving. The Penn State and Cornell researchers have demonstrated that cows with body condition score greater than 3.25 prepartum have greater risks of ketosis, and they produce 1 to 2 kg less milk during the first 30 days in milk than the cows with the body condition score less than 3.25. So this means if the cows they are heavier, they are more prone to metabolic disorders, and their milk production will be less during the first 30 days of lactation as compared to those which are having body condition score less than 3.25. This is another illustration from Elanco. Here you can see the different body condition scoring during different phases of lactation. During transition period, then in early lactation, then mid lactation, late lactation, and dry period. Just as a summary, prior to drying off, the body condition score should be between 3.25 to 3.5. Avoid too thin and too fat animal because both have an issues, and adjust weight gain or loss accordingly for 60 days of dry period. So just as a guideline, when cows are to be dried off, they stop lactating. They should be between a body score of 3.25 to 3.5 on a scale of 1 to 5. 1 mean very thin and 5 mean extremely fat. So you can use this illustration for comparing your own animal. This is from a research-based data, the Penn State Extension website, body condition score recommendations for lactating and dry cows. Here you can see the picture, body condition score 1, 2, 3, 4, 5, and you look at the subcut fat. The dry period from 60 until the animal is calving, the ideal body condition score is 3 to 3.5, and then from calving until there is a mid lactation, more than 70 days of this animal. During fresh and early lactation, the body condition score is 2.75 to 3, and then ideal body condition score is 3 to 3.5, that is during mid and late lactation. So from calving until 300 days in milk, that is the lactation period. As a brief note about the transition phase, so there is a little confusion. Close-up dry period and calving period as a transition period. So Elanco manual gives this 90 days as a transition phase or transition period, starting from far off dry period, 60 days until calving, and then 30 days after calving. That includes far off dry period, close up dry period, calving, and early lactation. However, from lactation point of view, in this lecture we have divided the period of 3 weeks before and 3 weeks after parturition as a transition period. Feeding of animals prior to calving. Dry period is usually of 60 days. Proper management and nutrition of the cow transitioning into lactation is very important for obtaining a healthy calf, increase reproductive efficiency, and optimal milk production in the following lactation. So they can only be achieved by feeding a balanced diet, providing good housing to the animal so that it feel more comfort, and having the animal with the good body condition score before and after calving. During the last 6 weeks before cow stops lactating and gets ready to have the calf, it is very important that the cow should be fed so that its nutrient needs can be met for the level of milk production in the coming lactation. At that time, the producer, they usually do not take care of the body condition of the animal. That is very important, and we have already discussed that cow should not be fatty at this time. The objectives of this dry period, they are number one, it to meet the needs of the unborn calf so that we have a healthy calf after parturition, and to increase the reproductive efficiency and to get maximum milk production in the upcoming lactation, and development of the immune and rumen ecosystem of the animal. Here I just want to emphasize on one more point. Previous studies, it has been recommended to give grain to the animal for the development of the rumen ecosystem for the following lactation, but some of the studies, they have indicated that carbohydrate type is not important, particularly in a pasture based system. There is no benefit from increasing the proportion of non-structural carbohydrate in the diet of pre-calving dairy cow. Though previously it was thought that increasing the supply of non-structural carbohydrate as a source of energy before calving, they stimulate rumen papilla development and provide nutrient for the developing calf, thereby sparing the maternal energy source. It was believed that adding these non-structural carbohydrate, they increase glucose and insulin production, and they consequently suppresses body condition score loss in the early lactation due to anti-lipolytic effect of insulin. However, the collective research in this area with pasture-based dairy cow does not indicate any performance benefit of increasing non-structural carbohydrate in the pre-calving diet. In a pasture-based system, we can avoid body condition scoring, as have already been discussed. The Elanco gave a reference that prior to calving, the cows should have a body condition score between 3.25 to 3.75. So the cows should not lose more than one body condition score after calving, and we have already discussed the reference where the animals whose body condition score is greater than 3.25, they were prone to more metabolic disorders, particularly they were more at risk of ketosis, and they also produce less milk, 1 to 2 kg per day less milk yield during the first 30 days of lactation than those animals whose body condition score were less than 3.25 prepartum. Overconditioning should be avoided because overconditions cows they will eat less before and after calving. If there are the fatter cows, they will mobilize body fat to a greater extent compared to those cows where feed intake is not compromised as greatly before calving. So as a result, fatter cows mobilize body fat to a greater extent compared to cows where feed intake is not compromised as greatly before calving. This greater mobilization of body fat causes excessive fat to accumulate in the liver of the cow that result in a fatty liver condition, and that also compromises the liver's ability to make glucose to support the milk production. Such cows they are more prone to fatty liver, and this disease might compromise their health after calving. Fatter cows they have greater difficulty in getting bred after calving and also feel difficulty in maintaining their pregnancy. So it is recommended that cows be managed to modify body condition later in lactation and achieve the desired calving body condition score at that time rather than during the dry period. If cows are becoming too heavy in late lactation, the energy content of the diet should be reduced at that time. Prior to calving, cows should not drop too much dry matter intake. Dry matter intake decreases 7 to 10 days before calving. That is also related to the change hormonal status of the animal, ketones body in the blood that usually increases in the blood as the cow begins to use body fat, and there is a immune suppression and definitely due to stress caused by a large calf inside the animal belly. Dairy cows can be expected to have a daily dry matter intake of about 2 to 2.5% of their body weight. The nutritionist or the farm manager they should observe the animal and make it sure that animals they are consuming the dry matter intake within this range. Also keep in mind that the cows that are over conditioned before they calve they eat less before and after calving, while feed intake dropping sooner and to a greater extent before calving than optimal body conditioned cows ready to calve. So as a result, the cow will mobilize body fat to a greater extent compared to the cows where feed intake is not compromised as greatly before calving. Already discussed, okay, this greater mobilization will result in fatty liver. The dry matter intake reduction is about 18% during the first 3 weeks of lactation. This is very important consideration to be managed particularly during the first 3 weeks of lactation. Prior to calving, about water requirement, usually a cow drink 4 to 5 liters of water per kg of dry matter intake. On an average, a cow consumes 50 to 60 liters of water on daily basis. For a very good cow, we should provide a clean and fresh water, and there should be a free access of water to all the cows all the time. So for better management of cows, and the dry period which is of usually 60 days, it is divided into 2 groups. The first group is called as far off or far dry group. It is 40 days period, 60 to 21 days prior to calving, and the second is close up or transition period, that is 21 days before to calving or lactation, or in some cases it is 14 days before to calving. So just divide this dry period into 2 groups is for the purpose of better management and feeding of cow. So during far off or far dry, what should be fed to the animal, as this period is from 60 to 21 days prior to calving. The diet fed to these cow will consist primarily of forages. It might be corn silage, it might have some straw, grass, hay, silage. diets fed to the far off group can be of lower energy density than those given to the close up group, because at this time the objective is to control the level of energy supplied in order to prevent the cow from getting too fat. The length of this far off dry period, it must be minimum of 30 days to allow for complete involution of the udder. Next comes the closer group. The objective of this group is to prepare cow for the lactation. During this phase, the objective is to increase the energy density of the diet and to prepare the cow for lactation. The diet has an energy level intermediate between that of far off dry cow diet and the fresh cow lactating diet. So approximately it is 1.5 megacalorie per kg. It is recommended that this close up dry cow period should be a minimum of 15 days to allow for mammary gland regeneration and colostrum formation. The close up should be 3 weeks long to ensure that cows will have a minimum 10 days receiving the transition diet. So if the transition diet is started 10 days before the cow's due date, in an experiment it has been shown that 4% of the cows will calve early and miss the entire transition diet, and the 18% will calve early and receive it for less than 5 days, that is about over a fifth of the cow. So the rumen must be stimulated by a high energy diet to stimulate rumen papilla elongation. This increases the surface area to absorb volatile fatty acids. Rumen microbial changes must occur as cow receive high energy diet after calving. Here are the advantages of having these two groups, where we divided the dry period into far off and close up groups, because these two groups they are fed separately, so that result in the following benefits: rumen adaptation to the lactating cow diet, energy balance and liver function improvement near to calving, provision of adequate energy as dry matter intake decreases prior to calving. However, there are certain disadvantages of this system. There is a more group shifting, because first we have to keep the animal in far off group and then we shift it into the close up group. So ultimately we have to prepare different diets for far off group and close up groups, that will increase the feed and labor cost, and in some cases may overfeed energy and provide less rumen fill at calving time. The Penn State scientists, they are recommended having a single group feeding, where far off plus close up group, their feeding management is done as a one group feeding. They are giving the advantages as the cows are all housed as one group and fed the same diet for the whole length of the dry period. Much of the focus is in close up rations has centered on the energy density of the diet. According to NRC 2001, 600 kg cow in the last few weeks prior to calving would only require 15 megacalorie of net energy per day. So if the cow consumes 12.7 kg of dry matter, the energy density of the ration should be only 1.17 megacalorie per kg, or 1.18 on round off basis. If that can be given to the animal, that can serve the purpose. By not feeding energy in excess of the requirement, it is thought that the cow will be at lower risk of the development of metabolic diseases post calving. So they have also given some advantages of one group dry cow feeding system. The number one is the number of times cow moves, they are reduced. So, and second, they eliminate the problem of early calving cows being moved from one pen to another. Third, it reduces the number of ration changes and mixes. Number 4, they give the advantage as low energy diet, 1.32 megacalorie per kg dry matter. It provides the rumen fill around time of calving. And in number 5, they have also mentioned that cause of higher fiber that may be less palatable if poor quality forages are fed and are because of straw usage to make a low energy diet, then at least they should be processed to have less than 2 inch in length. So it means the particle size, they should be less than 2 inch in length, otherwise the sorting will occur that might reduce the cow performance. They also recommended a low potassium and calcium diet that will help in improving the calcium homeostasis, that will protect the animal from hypocalcemia. Giving these guidelines indicated that choose of the system again depend upon the facilities, the managemental practices, so whatever is available on your farm, so you have to decide accordingly. So next come the nutrient needs. Here we will discuss energy, protein and other nutrient needs on individual basis. The reason being because during the dry period the nutritional needs, they are comparatively less for milk production as the animal is not producing, but nutrient needs for calf, they are on the higher side because the animal is pregnant and to provide a nutrient for the growth and development of the fetus. And then after lactation the cow should be prepared to utilize the nutrients. So we will discuss for individual nutrient. First one is energy. So during the dry period the energy need of the cows they differ from those during lactation. The cow no longer need energy to produce the milk. However, still there is a need for the energy. That need is mainly for the development of the fetus. About 60% of the fetal growth occur during the last 2 months of the pregnancy. So if sufficient nutrient such as energy they are not provided in the diet, the cow will draw that energy from the body reserves. There is a need to make it sure that adequate amount of glucose or the glucose precursors they are present in the diet, and that should be provided in the form of starch and sugar. When the cow is not lactating, she is eating almost half of the amount of dry matter than that should normally consume during the lactation phase. So at this time we should make sure that energy density of the diet is adequate to meet the needs of the rumen microbes to make microbial protein. In addition, nutrients are needed to maintain good rumen papilla growth such that their absorption capacity should be ready to meet the higher demands of nutrient just after the parturition. We have to keep in mind that gut tissues and the livers are not working as hard during the dry period, so we need to make sure they are prepared to increase in size and workload prior to calving with adequate energy sources in the diet. Therefore, including as many of feed ingredients in the ration pre-calving as the cow will receive post-calving. This will allow for the rumen bacteria and papilla to go through adaptation before the demand for milk production comes. So this can be achieved in both of the feeding program discussed in the previous slides. So the energy concentration also need to be higher for the first calf heifer because of their lower intakes and extra energy requirement for body growth. Just to summarize the energy need, it is required to maintain the body condition score, and due to excessive development of the fetus, for the pregnancy energy is required, and then for the body movement. The major issue during this period, the animal dry matter intake is half than that of the lactating cow, so there is a need to formulate energy dense diet and to add those feed stuff in the diet of the pre-calving cow that should be added in the post-calving diet, so that will help to maintain the ruminal ecosystem. High energy concentration is needed in the first calf heifer as compared to the elder cows, the reason being of their low dry matter intake and their energy needs for their body growth. Next comes the protein needs. So both quality and quantity is required. Protein needs of the animal, both quality and quantity of protein is very important for a dry cow feeding program. Underfeeding protein may lead to suppressed immune function and decreased availability of carrier protein needed for efficient metabolism. As the cow gets closer to calving, the calf's need for glucose and amino acid also increases. If the cow is short on protein, that animal will mobilize body muscle tissues, and that result in depletion of maternal protein reserves. Due to mobilization of these body reserves, animal could not be able to produce or cannot attain the peak milk yield in the following lactations. So that's why proteins they are important, and they are also required for the synthesis of hormones and maintaining a good hormonal status. It has been noted that total protein, blood protein, that decreases as the cow approaches the calving. This is due to the reason the calf is taking more of the protein, and at the same time cow is eating less. So there is a higher demand for glucose at the initiation of the lactation, causes another setback in the cow's protein status. And the body protein in the form of skeletal muscle, they get mobilized for glucose production. So that's why good quality protein source that provide all the essential amino acid need of the animal, they are very critical in a dry cow feeding program. Heifer require more protein in the diet as compared to the mature cow. This is again related to their low feed intake and their high protein required to accommodate its own growth as well as the developing fetus growth. The cows could be fed a diet with about at least a minimum of 12% protein in the pre-fresh transition period. So this is a minimum level of protein in the diet. Keep in mind 12% protein is the minimum protein that is required to maximize fiber digestion and microbial protein synthesis in the rumen. In case of this dry cow, there is a drop in the feed intake and animal is approaching towards the calving. Therefore, there is a need of greater percentage of CP in the diet rather than giving only 12% protein in the diet. It is recommended in case of heifer 1 to 2% more protein than that of the 12% protein in the diet. So if you are keeping a cow and heifer and they are fed the same prepartum diet, then the diet should be formulated to meet the needs of the heifers. However, if they are kept in a different housing, for each group a separate ration should be formulating. Considering additional requirement for mammary growth, heifer need approximately 1000 gram of metabolizable protein. So this is the protein that is actually absorbed by the intestine of the cow. 1000 gram of metabolizable protein can be met by feeding 1400 gram of CP in the diet. While the cow needs approximately 860 gram of metabolizable protein per day, then we should go for feeding 1230 gram of CP. So this is the difference between heifers and cow. Heifer needs 1000 gram of MP while cows need the 860 gram of MP per day basis. It is best to make the calculations of the dry matter intake, and then the CP level should be adjusted and calculated accordingly. Vitamin and minerals, we have to provide the sufficient amount of minerals and vitamins to the dry cow because they are required for the proper health of the animal and to develop the immune system of the animal. So calcium, magnesium, potassium, they are critical in the prevention of metabolic problems that can occur after calving. Sufficient quantity of calcium, selenium, vitamin A and E, iodine, copper, they are necessary to prevent problems like retained placenta. Copper, zinc, selenium and vitamin A and E, they all play a role in improving cow immune response. So feeding adequate amount of mineral and vitamin during the dry period is necessary to give the cow the best chance to fight off many diseases. The vitamin and mineral needs can be met by adding vitamin and mineral supplements available in the market. However, if you are formulating your own diet, then you can follow NRC recommendation. You can see here the recommendation of NRC for far off and close up a dry cow. So that can be followed to have a proper ration for the cow. That's a good guidelines and can be used for feeding the animal. So during a transition period, sometimes animal may suffer from number of metabolic diseases like hypocalcemia, retained placenta. So that's why we have to be very much careful while feeding animal during the dry period, and we should take care of their body condition score. Just look at this. Simply the low blood calcium or hypocalcemia that reduce the smooth muscle function, and it is related to poor teeth sphincter closure that result in the mastitis and ultimately into low milk production, and reduce smooth muscle function due to low calcium. They might cause prolapse, and that leads to poor reproduction. And similarly, this low calcium can result in low rumen motility, as the smooth muscles they cannot be properly contract. Then low uterine motility may occur, and they also lead to dystocia, retained membrane, slow involution. So all these metabolic disorders they are interlinked. So be careful while feeding your animal during the dry period. So just as a guideline, I will just focus only the hypocalcemia or the low blood calcium level. So that is less than 8 milligram per deciliter. So it causes a lower feed intake, retained placenta, and displaced abomasum. How it can be tackled: feeding acidogenic diet with anionic salt during close-up dry period reduces the chances of milk fever or hypocalcemia. Anion and cations, these are the terms which we used to describe the minerals in the ration. Anion or cation actually depends upon the charge on these elements. Chloride, sulfur and phosphorus in ration, they are considered as the anions, whereas the ration cations include sodium, potassium, calcium and magnesium. The dietary cation anion difference is calculated by subtracting the equivalent weight of anions from the equivalent weight of the cations. So the ration high in cation relative to anions or having a higher or positive cation anion balance are considered as alkaline ration, whereas the rations that are low in cations relative to anions or having a low or negative cation anion difference are considered acidic or negative. Milk fever is usually caused when the rations is alkaline in nature, whereas the acidic ration tend to prevent the milk fever. So when animals they are fed with acidic rations, they cause an increase in calcium mobilization from the bones, and they also stimulate the parathyroid hormone functions, so that protect the animal during the early lactation. When there is a high demand of calcium, the parathyroid hormone function is active, and that cause mobilization of calcium from the bone and can maintain the blood calcium level. So the detail how to calculate dietary cation anion balance will be discussed in metabolic disorder chapter or video. Here just to mention that the recommended dietary cation anion balance or difference to maintain blood calcium is -50 to -150. So when balancing dietary cation anion difference, chlorine can be added, but keep in mind that the ration calcium can be raised up to 100 gram using calcium carbonate or calcium phosphate 20 to 25 gram from inorganic sources. However, care must be taken that ration phosphorus 40 to 50 gram using dicalcium phosphate they can be added, but avoid phosphorus level over 60 gram as it can interfere with vitamin D conversion in the kidney. So close-up dry cow will experience a drop in urine pH when dietary cation anion difference goals are achieved. So better to check the urine pH of the animal. Normal urine pH is over 8. So if we are giving an optimal dietary cation anion diet to the animal, then it can drop to 6 to 6.5. But in some cow it might be up to 5.5 to 6. So below 5.5 urine pH is not recommended, because if urine pH is near 5, the kidney damage could occur. So always test animal pH while giving a negative DCAT diet to the animal. After calving, switch cow to a ration with a positive DCAT plus 200 to plus 400 milliequivalent per kg dry matter for higher intake and production. So this is all about feeding animal during the dry period. Thanks for watching this video, and I will upload the next video about feeding during the lactation phases: early lactation, mid lactation and late lactation. Thank you again. Hello, I am Dr. Tanveer Ahmad, Associate Professor